Morning or afternoon, everybody. My name is Gwen. I am a core faculty member on the Dallas campus in our OTD residential program. This is a study that we started with Samantha Lau, who is an OTD student who has graduated since, and then Lisa Grigg Stapleton, that we've been working on this as a collaborative effort. So a little bit of background, we are looking specifically at the viewpoints of hand therapists and their experiences and opinions about telehealth. So we were looking at the background and then how COVID really dramatically changed telehealth practices for hand therapists in particular, and especially because we were trying to improve not only access during COVID, but access to therapy during for rural areas as well. We have also found that there's no significant change in outcomes. So they did several studies where they compared in-person treatment to telehealth treatment, and they found no difference in the long run. It doesn't take any longer. There's had the same amount of satisfaction. So I thought that was also interesting as part of the background. But there is a continued resistance to use telehealth and hand therapy. But I will talk more about that in a moment. But the problem statement of this research was the research continues to look at opinions on telehealth delivery services across the medical and allied health spectrum and how it is used in patient interaction, but minimal research exists exploring the viewpoints of hand therapists and the practice of telehealth. The purpose statement of this research, the purpose of this study was to conduct a research study with hand therapists associated with the American Society of Hand Therapists to learn about different perspectives on telehealth for upper extremity rehabilitation. And our research questions. So keep in mind, we were doing this research and gathering data in the spring term of 2022. This is a mixed method study. There was a lot of questions, a lot of coding. So I'll get to that here in just a moment. But the research questions were, what are the viewpoints of hand therapists in the United States for telehealth and hand therapy? Was there a change in the use of telehealth among hand therapists during the COVID-19 pandemic? And are there any demographic trends of the hand therapists who participate in telehealth? So our participants were American Society of Hand Therapy members. We asked that the inclusive criteria be members that have been practicing in a hand therapy clinic for like greater than 6 months. So we didn't necessarily want just like basic new grads. We wanted somebody that's been out for at least a little while. And we ended up with a total of 153 participants. The methods, so we used the ASHT research division and distributed the survey through emails to all active members once, and then we did one reminder approximately 2 weeks later. The survey was open for 8 weeks, and it took between 15 and 30 minutes to complete. That was our best guess at the time, but I'll talk more about that in limitations. Only participants that have been practicing for more than 6 months completed the were asked to complete the survey. We kept everything as confidential as possible. We asked demographic questions, but there's no identifying information. And then data were collected in the spring 2022 term. So demographic information, one of the very first things that we found that was really interesting is that 79% of our participants have been practicing more than 10 years. And then 44 participants were over the age of 55, with 67% of participants over the age of 45. Something else to keep in mind that as far as gender is concerned, we're not really surprised with our findings. That's pretty much in tune with most allied health and therapy practices. It is a little bit higher in the female end, especially considering that you can be an OT-PT or both OT and PT in order to be a hand therapist. So it's a little higher than we anticipated, but not by much. And then it was overwhelmingly OT versus PT as far as our respondents. If you're looking at HTCC, the Hand Therapy Certification Commission, between 70 and 80% of certified hand therapists are occupational therapists. So this is just more of a representation of the demographic trend. So more than half of our participants have been practicing for more than 20 years. And if you look at the graph on the right, the pie chart on the right, when you look at the green and the orange together, that's what I was talking about in the previous slide about how many people are truly falling into that 20 years or more and significant experience. So more demographic information, 53% of participants were practicing with a bachelor's degree and 38% were practicing with a master's degree. There's been a change in a trend for occupational therapists like physical therapists that we have switched, and we kind of grandfathered in those practicing with a bachelor's degree into the changes that we made when we moved to a master's degree. So we can get a doctorate degree, but it's not required to practice. Entry level is still an MOT for occupational therapists at this time. So when you look at the numbers for that, and then as a certified hand therapist, 128 or 87% of our participants were CHTs, and 74% of the people that we surveyed that participated did participate in telehealth. So I thought this was a really interesting statistic as well. So we broke it down as a Likert scale for part of the quantitative measure, and 67% of our participants were less than moderately interested in participating in telehealth. And this is a trend that we found all the way through the data, but I'll talk about that here a little bit more in just a moment. And then as far as assessment trends, we found primarily people were using goniometric measurements of some sort or digital versions of pain assessments. From there, we found that in the coding itself or in the open-ended questions, the responses weren't really well defined about what else people were using. We have a good guess that they were using functional assessments in their home environments. But some of the specifics about that is still unknown because we did send it as an open-ended question as part of a survey for the qualitative measure. Opinions on using telehealth for evaluations. So the codes that we found, the themes that we found is it's not accurate or specific enough, and it's a lack of objective measures. It's a lack of hands-on, and a lot of therapists mentioned specifically about like palpation, special testing, scar management, those types of things that they were really frustrated. Modalities it falls into that as well about the lack of hands-on. And then there was non-specific reasons why they didn't want to use it. Some of the quotes that went with that is no thanks, not sufficient, or pointless. Um, And what we also found is when we compared their opinion about telehealth versus in person, I put a traffic light on this one because we really felt like it was a green, yellow, red kind of situation. Red being in person's the better method without further explanation. Yellow being, yeah, it's okay. It's better than nothing, but we still don't love it. There were enough to create the theme that it felt like it was an effective delivery method, but we didn't get a ton of further explanation about why they felt that way. So foundation for further study about why. And then instances where telehealth is appropriate. Some of the themes that we found, it's diagnosis specific. So they really prefer non-surgical or non-traumatic injuries, improving rural area access. It's helpful for patient education or HEP, but it's not necessarily something they want to do as far as an eval. And then helpful for patient history and home context or screenings. Are you appropriate for hand therapy or not? And that's something that popped up as a thematic analysis as well. Other. So we had an other section where they could add some information. We were hoping to tease out a little bit more about what they were looking for. And then telehealth is more challenging and more difficult than in-person evaluations was a theme that we found. And then a lack of privacy in the clinic or HIPAA concerns. Anybody that's worked in an outpatient clinic, OT, PT, speech, whoever, I think we can all agree that sometimes privacy can be a really tricky thing in a busy clinic. So even though I'm having, as a telehealth provider, I have headphones on, so my clinic can't hear what the patient's saying to me, but they can still hear what I'm saying back to my patient. So, do I have a private room? Do I have the equipment that I need? Do I have the lighting? Do I have the setup? And I've got to be worried about where my patient is on the other side. For example, I once had a patient that was trying to do a telehealth session in a closet in the back of a barber shop while he was visiting his son. It's a little tricky sometimes, especially when you're talking about HIPAA. So discussion. What I thought was very interesting as well is education standards. So when you look at our demographic data, more than half of our participants were actually practicing for more than 20 years. When I went back, and it got me thinking about standards and what we're teaching our OT and PT students. What I found is that ACOT, which is the OT standards, didn't have specific telehealth education standards until 2018. CAPT, which is the PT standards, they still don't have a specific telehealth requirement. If you look at their standards, they talk about how they need to be educating students on contemporary practice areas that could include telehealth, but it doesn't necessarily need to. So it got me thinking about perhaps the therapists that responded to the survey didn't like telehealth because they've never had any access to it. They've never been taught how, and no experience with it with somebody that can give objective feedback. They kind of got tossed in because of COVID. So it got me thinking about that. And then the hands-on and slash the human element. The lack of hands-on was limiting for respondents for objective measures, palpation, and social connection. However, there are several studies that compare telehealth in different formats and found no difference in outcomes. The American Society of Hand Therapists, over the past few years, have come up with several articles that talk about on-screen measurements have really good inter-rater reliability. We know that we can do coordination. We know we can do strength in a virtual format. But that goes back to the education piece. If you didn't know what to do and how to do these things, you've never been taught, no wonder you're not comfortable doing it. So that made sense. And then as far as further thoughts, Sequeiros and Valdez did a pretty robust study about the use of telehealth and um, what types of assessments that the participants were doing. And we actually found a pretty decent correlation with what they found, what we found on that question. That 70% of hand therapists do use telehealth in some sort of either virtual or hybrid format. So maybe the patient comes in a couple times, you see them virtually a couple times back and forth. 32% range of motion, 19% perform physical assessments like special tests, and then 26% perform patient-reported outcome measures like the DASH, for example. Recent literature is reporting that telehealth services and hand therapy, that it is supported in the literature, but when we were asking these people back in 2022, kind of in the beginning / height of COVID, I think that perhaps the emerging research is telling us what we thought we knew, but that's not how this particular group of respondents felt about it. As far as limitations, the survey was provided only to ASHT members. While we have quite a robust group of ASHT members, and we got 150 responses, which is huge, we didn't have homogeny. So, the majority were over the age of 55. And that led me to, it's a lack of responses from younger or less experienced therapists. Are they more comfortable with technology? So they were like, let's figure it out. Is there some imposter syndrome that tells them, I'm not really part of this. That's not really for me. I have questions about why that happened, but I consider that a limitation for the lack of homogeny. The survey itself took 15 to 30 minutes to complete based on the instructions, but the length of some of the responses that we got were really robust. I'm wondering if perhaps we had therapists that got into this and then decided not to finish it, or perhaps they started to get some survey fatigue and the answers kind of trailed off as the timing wore on. But I think that could be considered a limitation. And there's also a very big gap in the literature about the hands-on / human element when it comes to telehealth. In my experience, I did not experience the lack of that human element. In fact, being in somebody's environment, even virtually, I felt like made it more robust, but that's my opinion. We don't have the research to back that up just yet. For conclusions, the majority of our participants did not want to participate in telehealth services. They also didn't feel like they were useful. They felt like a lack of privacy actually hindered the ability to use telehealth. And then the lack of homogeny could skew the results as well. So here are my references, and I will open it up for questions.
Any questions for Gwen? That was great.
Thank you. Work in progress. We're hoping to submit it for publication here very soon.